everyone, my name is Sabrina Angiana, and this will be my class presentation based off my annotated bibliography. And our topic we're going over today is obesity, so I titled mine, I Scream, You Scream, We All Scream Obesity. What we are going over today is the problem with obesity and all of the diseases that spring off from it. This disease occurs in all ages all over the world, and we'll also discuss why social media has a role in that problem. The thesis for this project is, it is no surprise that obesity is a major concern for people of all ages all over the world, but mainly the United States. We have come to normalize this disease as if it is something to be proud of, rather than facing the hard facts that there needs to be a change. Social media has put a major influence on quote-unquote loving yourself for who you are no matter your size, and encouraging those who are obese to continue in their ways. Even though it may not be the case for all, this is becoming a reoccurring event that has to make a change for the better of these people so they can love the quote-unquote healthier versions of themselves instead. The overview of this project is that there will be visuals based off the journals, websites, and books I obtained from the annotated bibliography, and I'll incorporate what I learned from all 10 sources. I hope you all sit back and enjoy. Now let's get started. With these next two slides, we are going to be looking over some basic obesity statistic visuals that correlate with the two books I had found for my annotated bibliography. The first is written by Dr. Frank Hu. This book was written by a professor of nutrition and epidemiology, which he discusses the increasing rate of obesity cases in the United States, and not only that, but other weight-bearing diseases as well. He furthers his discussion by describing what exactly his profession does, which displays the many studies they are looking into when it comes to obesity. It also explains how the benefit of a case control design is being able to reach different occasional results and can be able to do so at a cheaper buy. Now, for those who don't know, according to the CDC, epidemiology is stated as the method used to find the causes of health outcomes and diseases in populations, and in this case, obesity. And even in his first two paragraphs of his book, he describes obesity epidemiology uses epidemiologic approaches to examine the causes and consequences of obesity in human populations. It also includes the study of multiple broad interrelated domains such as the distributions, patterns, and dynamics of obesity in populations, B. Health and other consequences of obesity, C. The determinants or causes of obesity, and D. The development and validation of body composition measurement methods used in epidemiologic study. And there's a ton of knowledge gained from all these different types of research they've put into it. But now, looking at this chart on this slide, you can see the obesity rates continue to trend up in the United States. Percentage of U.S. adults who are obese based on height and weight survey. Based off this data, you can see that since 1999/2000, the numbers have almost doubled every year except in 2011-2012. And in my opinion, and this is purely based on my own knowledge and own research and own personal experiences I went through during this time, because this was my 8th grade year going into high school, I believe that the number had went down this year because of the campaign from Michelle Obama, Let's Move, hitting its peak for healthier children. And this was when she would start really implementing in high schools, in junior high schools, where they try to put more healthier options for kids, try to influence more exercise and more outdoor time. And I saw so many commercials, I saw so many advertisements all over. So in my opinion, I feel like that's why this number started going down. But back to the data, it is simply so shocking to see the number for a country go up from 29.9 to 42 in less than 20 years. Now, based off the information, it is stated that the high obesity rates in the residents make basic control studies less wanted by researchers for these obesity lifestyles, but they can still be of use for some different biological marks. Now, what this basically means is that some of these obesity cases are not wanted as much because of how many they are starting to see all over these residents, as you can tell as the years have gone based on this statistic. But instead, they are starting to use them as a different type of mark for their research. Who even states that in his book that the last 3 decades have witnessed an alarming increase in obesity rates in the United States and other industrialized countries. Many developing countries where there has been a dramatic shift from undernutrition to overnutrition are also experiencing a marked rise in obesity and obesity-related diseases, including hypertension, type 2 diabetes, and cardiovascular disease, as stated before. With this chart, you obviously see that the estimated percentage of U.S. youth with obesity between the ages of 2 to 19. According to any basic BMI calculation chart, obese is considered anything 30.0 or higher, and it is then categorized into 3 different types of classes, kind of like a type 1 and type 2 diabetes entity. All classes are based on BMI, and class 1 is 30 to 34, class 2 35 to 39, and class 3 is anything above 40, or in other words, an extreme or severe class. And that's all based off the BMI chart. Now, obesity is a complex multifactorial disease that develops from the interaction between genotype within you and the environment, your surroundings. And also, what's stated within this book by Goodwin is today healthcare practitioners are encouraged to play a greater role in the management of obesity. Now, based off of the book, it discusses the treatment for obesity, and that being that it is just a 2-step process/procedure. Step 1 being assessment, and then second being management to give the patient information that will benefit them with their problems, rather than making them worse and resulting back to old habits. The final thoughts of the messages were that there is always physical health to bring into aspect to help obese patients of all ages. With this chart, now the main reason for adding this picture is because it was found from Mayo Clinic, proving that having obesity makes you more vulnerable and associated with greater risk for death with COVID-19. Now, how crazy is it to think that one major epidemiology faced with over the past 20 years, can cause death for the current epidemiology we are facing in America today? Now, you can see from the picture there's immune dysfunction, pulmonary function problems, heart diseases, kidney diseases, cardiometabolic diseases, inflammation, and so much more. And it's so crazy that nobody is hearing anything about this. This is my first time seeing it, and I had to really look for it in order to find it. Why is this information not being shown out more and bringing light to this problem instead of hiding it from everybody? That's something that we really need to start looking into, and social media really needs to start getting into that, because it states that clinicians need to be more aggressive when treating obese, especially severely obese patients with COVID-19 infection. And how many obese patients do you think really know about this problem? Now, so instead of going over each 6 of the scholarly journals that I had found. I'll be summarizing 3 and 3 over these next 2 slides, and including these visuals that I think ties in best with what all of them had to talk about. Now, with these obesity rates, we obviously see that United States is leading the leaderboards by a lot. But what's surprising is that Japan is almost 10 times smaller than what our number is. And instead of feeding into what the U.S. is doing wrong, why have we not tried to look into what Japan is doing right and how we can fix what we're doing? But what was found in some of the journals was the reasoning behind this epidemic of overweight people is based off the move from healthier foods to processed, high-calorie foods over the past years, and that's including all the things given in fast food places, restaurants that claim to have healthy options, but really just add to the bad foods that we eat. Many countries have been able to learn from our mistakes and make that change to help their people, and it will only get worse for our country as the years go on with no alteration to our problem. Although we could not prevent this disease from ongoing, we have been able to get a better understanding from it to help those who are truly struggling from obesity. But according to our numbers, it's obviously not working out that well. So the reason why you're just seeing a chart on this slide is because this was one of the main things I wanted to include in my research, which is Robert Whitaker's research on obesity in young adulthood from childhood and parental obesity, which is someone we actually see and hear a lot about in the book we're actually reading for this class. So, to further get into it, it is further explained that the different types of therapy and how prevention programs can be most cost-effective and beneficial rather than the weight loss programs. This test was based off height and weight measurements within 854 subjects on a BMI scale, and the results show that 16% of the young adults from 21 to 29 years old were obese. He then categorized the subjects by whether they had 2 or 1 obese parent influence in their life, and that really had a change on the child's behavior towards obesity, as you can see on the charts. One of the 2 websites from my annotated bibliography states, it goes into detail about the dissatisfaction with our bodies and how it is seen as a psychological correlation to obesity that ties in with major negative effects to the body like disordered eating, depression, and poor self-esteem. The other website reveals that few researchers have systematically examined factors associated with childhood obesity among ethnic minorities. You would hope that researchers would have already taken these factors into consideration, but it is the opposite, and it is time for a change. Overall, data continues to show that obesity is an ongoing problem for many years, and there needs to be a solution to help lower and shift this disease.